Good morning, everyone. We're going to get started. Thank you for joining us today at our March PFA meeting for our wonderful speaker. But before we get started, there's just a couple of pieces of business. We need to approve our minutes from our February meeting. So all in favor of the PFA minutes? First, can I have a second? All in favor? Any opposed? Minutes passed. That's not the right wording, but it was close enough. And then I would like to introduce Jen Richardson. She is one of the chairs for our post-prom event, which is coming up, and she has a few words she'd like to share with you.
Literally the best time ever. I had it. I went when I graduated here as well. But we are having an event. It's called Ram Jam. It's on March 29th, and this is kind of in lieu of the fashion show that's been typically done. We're kind of shaking things up a little bit this year, and we are doing it's like a lip sync, live music, and fashion show to celebrate our seniors. So it is going to be so much fun. We did band impersonation when I grew up here, and it was literally the best event to go. All the kids came. We're really wanting parents to come, supporting our seniors. All the money that we raise from this is going to the post-prom event. And again, it's March 29th. I've had major difficulties with this, but I'm trying to do it. Like, this is the QR code. I keep saying CR, it's the QR code, and you just scan it with your phone. You can go directly to the Eventbrite site to buy tickets, or you can go on Eventbrite to find them, or just go on our website. So thank you so much for your support, and we hope to see you guys there. Thanks.
Hi everyone, I want to thank you all for coming today. We are super excited today to have Dr. Tony Pugliafico from the Columbia University Clinic for the Child and Adolescent Disorders. He is the director, and he will be speaking to us today about the idea of parents and families identifying disorders, seeking treatment, and your child's mental health. Tony.
Thank you so much. Thank you to Renee and Heather for putting this event together and organizing this. Thank you so much for everyone for being here. It's certainly an important topic for me to be discussing managing stress and anxiety, and I'm just so glad that there's such interest in the community here. Just by way of introduction and background, my name is Tony Pugliafico. I am a clinical psychologist, and I direct our outpatient clinic for anxiety and related disorders in Tarrytown. So we're about 45 minutes away. We're part of Columbia's psychiatry department. So, work closely with our research staff, with our other clinical staff, and are able to, really kind of provide state-of-the-art treatment. But what I'm really here to talk about is something that matters a lot to me, is how do we help identify and support kids before they're coming to my office? How do we help identify stressors? How do we help minimize stressors for kids and adolescents? And how do we also help them kind of like strive through and sometimes struggle through all the stressors that kids and teenagers are facing these days? So, hopefully, what we'll be talking about today are many concrete strategies that you as parents can use. I want to certainly reserve, a good 15 or 20 minutes at the end for Q&A, but I'm also hoping this can be as conversational as possible as well. So just by way of agenda, what I was hoping to do is just give an overview about what we know about anxiety, just some brief information about anxiety disorders and names you may hear or know some about, just to kind of put some description to those names, but also talk a little more in detail about what does that look like? What are those soft signs and red flags, so to speak, that we may see in teenagers that can help give a clue that they're perhaps dealing with increased stress or anxiety? What can be done in the home setting, or how can we as parents help kids manage in the school setting? And then talk a little bit more about what treatment options are out there for kids who are really struggling with problematic anxiety. I'll start, though, by asking, what is anxiety? You know, essentially anxiety is a universal feeling. We all have it. If you're sitting there thinking, I don't have anxiety, you're lying. It's adaptive and it's a survival tactic. You know, anxiety gets us up in the morning, gets us to work, gets us to kind of prepare for the things we have to do. You know, I had a ping of anxiety just kind of coming in here, especially knowing like the video recorder's going. I'm like, all right, game on. But anxiety can be a good thing. It helps us perform better. It helps us, you know, be ready for danger. You know, that's anxiety stuck around because, you know, when we were cavemen, we had to make sure we didn't go up and pet that saber-toothed tiger. You know, it's a good thing, like many of our emotions. When anxiety becomes problematic is when the volume kind of gets increased. You know, the analogy that, you know, I like a lot is, you know, our anxiety alarm can work kind of like a fire alarm. It's really good at telling us when there's danger, but sometimes goes off when there's, you know, for false alarms. If there's food burning or steam from the shower, our anxiety works in the same way. It's really good at telling us when there's danger, but for some of us with oversensitive anxiety alarms, it'll go off, you know, for false alarms, and it'll tell us that there's danger when there's not. So for those of us with kind of lower thresholds for anxiety, it's important to start identifying when those false alarms happen. And if you're a parent of a kid with that lower threshold, it's important to, you know, to find that balance between helping them identify those false alarms and sometimes helping kids struggle through those feelings of anxiety. And I'll help, you know, allowing our kids to feel that anxiety. Because I'll tell you, we're about to talk about anxiety disorders. More often than not, or actually quite typically, when an anxiety disorder happens is when kids are trying their hardest not to feel anxiety. And this happens for adults too. What creates an anxiety disorder is when we start avoiding and when we start doing a lot of safety behaviors and reassurance behaviors because we don't want to feel that anxiety. You know, a classic example would be if you're a kid, if you're a teenager who's pretty shy and kind of nervous about kind of being out in the world, interacting with peers, interacting with teachers, you know, it's not that feeling itself that's going to create the disorder and create the problems. It's going to be when you're avoiding reaching out to friends. It's going to be when you're sitting by yourself at the lunch table. It's going to be when you're not seeking out a teacher when you don't understand the material at school because you're too afraid to do that. That avoidance is what becomes problematic, not the feeling itself. So what we want to do, what I always want to do as a clinician, and this is really what the treatment involves, and what I would encourage all of you to do as parents, and we'll talk more specifically about how to do this, is helping our kids feel anxiety, you know, live through anxiety, tolerate distress and uncertainty in the service of learning how to do that and sitting with it and realizing they'll be okay on the other end versus trying to escape and avoid anxiety, you know, and learning that that's the only way to make it go away. So, you know, we talked about this some, but when does anxiety become a disorder? Really, the point at which we're seeing anxiety get to a problematic level is when it's causing impairment in one of those main areas for teenagers. So for school, if we're seeing kids either, you know, struggling academically or, you know, in more severe cases, we'll see kids who have trouble even getting to school and kind of making it to school regularly and making it to school on time regularly. So that's a very, very clear sign of impairment. We'll see social impairment often, you know, with kids with anxiety, kids who are struggling to either kind of be in it socially, or sometimes this could be more subtle. Like I'll have kids who I'm seeing and you wouldn't know it at all looking at these kids that they're socially anxious. They seem very well adjusted, they're charming, they're very engaging, but they'll let me know, you know, I've got my 3 or 4 friends, like I know my people, I know, like, you know, they're safe, but I would never I would never talk to other kids at school, or I get really uncomfortable if I'm stuck like sitting next to someone I don't know so well, or, you know, I'm not going to initiate a text. Like if I get texted, that's fine. Like I'm there, and I'll respond. But there's you know these subtle signs of anxiety as well, and impairment that can be more subtle, and then family and home impairment. A lot of times with our kids with higher anxiety, we'll see a lot of reassurance seeking. We'll see a lot of, you know, struggles around homework, either completing homework or like, you know, needing, procrastinating homework because it's too anxiety provoking. And then there's that, age old fight between why don't you get your homework started and maybe it's time to turn off the YouTube and then it's like 1 a.m. and kids still doing their homework. Or it can just be, arguments around ways that things are done at home. And we'll see this. I've had kids with obsessive compulsive disorder or other kind of concerns where they need things done a certain way at home. And it can bring up a lot of tension and a lot of conflict around, just around the way the home environment works. So those are all indicators of when anxiety kind of jumps into a problematic place when we're talking about an anxiety disorder versus just that general anxiety that we all experience time to time. And then there are some kids where they're rocking and rolling, they're doing just fine, but inside they're so distressed by anxiety. I've worked with a number of kids who are doing quite well academically. They're doing everything they need to do socially or at home, but they're racked by anxiety and worry, about like, how do I keep this up? It might impact sleep. It might impact kind of other areas. And so that like high level of distress is another criteria for an anxiety disorder versus anxiety. Whereas we want to, like I said, we want to help our kids tolerate anxiety and live with anxiety, we also want to address anxiety disorders quickly and early because we have good treatments that we'll talk about. And there are things, we know how to treat child anxiety. And the earlier we can, the better trajectory we can send our kids on. So whether that's elementary school, whether it's high school, there's never a too late, but the earlier the better. Because what we know is that anxiety can be treated, but if left untreated, that problematic anxiety doesn't just go away on its own. It lingers and sometimes can become worse. So, it's just something to keep in mind. And what I'm hoping in our talk today is that we can, I can help distinguish and help you guys distinguish what levels of anxiety are we okay kind of, tolerating, sitting with, kind of helping our kids struggle through, when to, begin addressing this at home or in the school setting, and when outside help might be helpful. Let's go through this briefly then. Let's talk about like our main disorders, and these are probably names you guys have all heard, but I just want to be able to put a little description around it. So social anxiety disorder, this is essentially like our extreme shyness. This isn't just a shy kid. This is a kid or a teenager who's really kind of life is impaired by anxiety. There's a lot of fear around negative evaluation or embarrassment. This is that kid who I described a little earlier, who may not participate in class, who may not reach out to other peers, who may avoid being assertive in interpersonal situations, and may find kind of ways to kind of navigate, particularly in a high school setting, where I think it's harder for these kids is, when they are more independent. These are the kids who often kind of can get to college, but then it's a real struggle navigating socially when there's a brand new set of peers, or being willing to be assertive and seeking out a professor for office hours, or, asking a professor for help, or, navigating all the other kind of like subtle social situations that happen in that type of setting. The fear can lead to avoidance or extreme distress. And we'll see kind of signs of this in late childhood and particularly in adolescence. So that's our kind of social anxiety disorder. You also may hear generalized anxiety disorder. These are like our little adults. We used to call them like the little Woody Allens, and we've moved away from that. But, like these are the kids where like the worry wheels are going a lot, and it's like Baskin Robbins. It's like the flavor may change, but it's like 31 flavors. Like if I'm not worrying about, my English grade, I'm worrying about, the polar bears in Antarctica, or I'm worried about, what my friends are going to be doing today, or I'm worried about, do my parents like have enough money, or are they getting along, or like what's going on with my sister and why is she still coughing after a week? And the worries can kind of change. We can see a lot of reassurance seeking, and sometimes, particularly in adolescence, you might not hear the reassurance seeking as much because adolescents might be kind of keeping it inward more. But what you might see are physical symptoms: headaches, stomach aches, irritability. That's a lot of times those first signs of worry or like this generalized anxiety in our teens. obsessive compulsive disorder is actually more common than than we would think. There's about 2% of individuals experience obsessive compulsive disorder, OCD. So that's like 1 out of 50 individuals. And just for just for reference, anxiety disorders in general have a 10% lifetime prevalence. So what that means is 1 out of 10 people, 1 out of 10 of us will meet criteria for an anxiety disorder at some point in our lives. What that tells me is that it's pretty common, and it's something to always kind of keep an eye out for. With obsessive compulsive disorders, and we hear this a lot, like, oh, I'm so OCD, or I'm so OCD about this or that, or what have you. When you've really got OCD, what it means is that you're having intrusive thoughts, unwelcome thoughts. It could be about any numbers of topics, but most commonly we'll see concerns about germs or cleanliness. We'll see concerns about doing things perfectly. Sometimes these are the kids who need every word written or typed to be exactly right, or things to be kind of exactly in the right way. But we could also see obsessions about topics that these kids don't want to be thinking about. We'll have a lot of kids with thoughts about being blasphemous or offending God, or sexual thoughts they don't want to have but that are coming up, and they're really upsetting, and for good reason. These kids, teenagers aren't coming to their parents and saying, hey, mom and dad, guess what, I'm having this horrible thought about whatever. But they could be really upsetting, and then as a result, a lot of times kids will engage in compulsions or ritualistic behaviors. If I'm having this really upsetting thought that I've got Ebola on my hands, I'm going to wash my hands a lot. And if that thought keeps coming, I'm going to keep washing them even more. If I'm having a really upsetting thought about sinning and going to hell because I didn't say my prayers right, I'm going to say my prayers 20 times in a row to make sure they're super right. And that's, in the same way that anxiety disorders kind of come from the avoidance, the problem with OCD are those compulsions, those rituals, the reassurance that kind of takes up a ton of time. And we can see this as early as 3 or 4, but typically in childhood and adolescence, we'll see this type of presentation. And there's other anxiety disorders that we'll see, but less frequently. Specific phobias, they exist and they're pretty common. Typically, they're not going to get in the way of going to school, but these are our kids who aren't just afraid of shots, but can't get a flu shot. Who can't be around dogs. A very specific fear that can get in the way and cause impairment. Panic disorder, we'll typically see more in adolescence and adulthood. And post-traumatic stress disorder, again, not as common, but is a lot of anxiety symptoms that kind of follow from a traumatic event or a perceived traumatic event. I think what's much more important than understanding these terms is knowing that anxiety in and of itself, and we sometimes talk about the big ball of anxiety, can be problematic. And we often see these disorders kind of commingle and coexist and sometimes change. We are much less concerned with getting the exact diagnosis right, although proper diagnosis is helpful, but anxiety disorders change and evolve. So, it's important to kind of understand these terms. What's more important to know is, how to manage anxiety, and that oftentimes we'll see this big ball. And, let's talk about those red flags. Let me just ask really quickly, what are signs that you guys might think, or in your experience might come up for, how would you know if a kid's experiencing kind of more higher level anxiety? What might be some red flags that come to mind? How would we know in general if a kid is feeling anxious? Avoidance. Yes. Lashing out. So absolutely, particularly in our teenagers, right? We're going to see a lot more of that irritability and lashing out and arguing and conflict as a sign of what's up. Think about, I know in my life, if I've got 200 things on my mind, work and this and that, I'm going to have much less patience for, if my kids are dilly-dallying or, having trouble getting out the door. There's just less gas in the tank, And so if I'm a kid and I'm worrying about school and I'm really concerned about having to go to this party later because I'm not sure who's going to be there, and, I'm also just feeling a lot of physiological anxiety, I'm going to have a lot less patience when my mom or dad is saying, hey, did you get your homework done? And did you do this? And how's this going? So we see it as lashing out. Absolutely. Other red flags? Yeah. Physical symptoms. There we go. Those are often our first sign, right? So besides irritability, who do you think is like the person in the school setting who sees the kids with anxiety first? Absolutely. The school nurse usually could give the most accurate list of which kids are struggling most with anxiety, because more often than kids saying, I'm feeling really anxious or I'm feeling really worried, it's, my stomach is killing me. I can't get through the school day. I might throw up. Or my head, I'm having migraines, I'm having headaches, I just can't be here. I just don't feel well enough to be at school. Physical symptoms are absolutely a component of anxiety. Physical symptoms are real. And also, they're driven by feeling anxious. So they're a big clue for us. And we'll talk about later about how to manage those. But, stomach aches, headaches, also trouble catching breath, complaints of nausea, going to the bathroom a lot, chest tightness, heart racing, feeling faint. All of these are, these are our fight or flight symptoms, right? So think about when you're feeling really nervous, what happens? You feel the pit of your stomach, that butterfly feeling, the chest tightness. For me, I get that muscle, that neck and shoulder tightness as well. This is, again, harking back to our cavemen days. Our body's getting ready to run away from that saber-toothed tiger. These days, the saber-toothed tigers are, math tests and what the rest of the grade is doing Friday night. And everything else along those lines. And these physical symptoms don't necessarily help us handle those things, but they're residual. They're still there. They're still what happens when we're anxious. And they're usually our first sign. What are some other red flags, though? We'll see teenagers avoiding certain parts of school. For some teenagers, lunch is a big, big stressor. So, if teenagers are deciding, I've been catching up a lot in the library during lunch. I'm really getting more work done. That may be great, or that may be a sign that lunch is super stressful. I don't know how to navigate, sitting with certain kids, or I'm having a fight with my friend and I have no one else to sit with, and can be a sign. Same with in high school, recess is less of a thing, but certainly extracurricular activities, kind of kids putting themselves out there, out of their comfort zones. Discomfort with the center of attention. I've had kids say, I'm just not the type of student who participates in class. That's just not my thing. Again, that to me says there's something uncomfortable about putting yourself out there, making mistakes, being willing to kind of be out there socially. And calling or texting parents often will, I think that smartphones have been such a wonderful technology, and I'm probably preaching the choir here, right? It's like a double-edged sword. It's wonderful in so many ways, and it creates problems in so many ways, and it creates anxiety in so many ways. But if your child is calling or texting you a lot from school, I can't handle this, I can't do this, is this okay, is that okay? That's a big old red flag that, that anxiety is higher. Avoiding initiating social contact. So the kids who say I'll see if my friends contact me this weekend, but they're not going to be the ones who put themselves out there and say, hey, let's go to a movie, or let's drive around, let's go into town, whatever it is. Trouble paying attention is a big one. A lot of times kids get misdiagnosed with ADHD or other problems when it's actually anxiety that's getting in the way of their attention. And believe me, there's our kids who do have legitimate attention concerns, and we need to address that properly. But I always mention to parents, and when there's an attention problem, just suss it out a bit, or work with school or work with a professional to suss it out a bit, because it could be that anxiety, and we're not talking about depression today, but depression can also sap a kid's attention and make it really hard to concentrate at school or with schoolwork. So trouble paying attention is another one of those red flags. Extra time spent on homework. So kids who are doing and redoing and studying and overstudying because they want to make sure they get 100. And the opposite, which would be kids procrastinating, not wanting to do their homework because it's so stressful. And I've worked with kids who would much prefer to not study or like barely study and get a poorer grade or kind of like, not do as well because they know that they didn't study versus, the possibility of studying and putting forth their best effort and then not doing well. The idea of that is really anxiety provoking. So, listen, kids procrastinate for all types of reasons right now. It's hard not to procrastinate when you have like a million YouTube videos to watch and like your friends every 2 seconds like group texting you and like Snapchatting you and everything else. But a lot of times for our higher anxiety kids, it can also be anxiety that's driving that procrastination. Frequently asking for reassurance, difficulty sleeping or falling asleep or staying asleep, and then we've certainly talked about irritability. So these are all kind of red flags that we see. And if you're seeing one or two of these, it may not, I wouldn't say, if you saw one thing there, doesn't mean your kid is anxious. And it doesn't mean your kid has an anxiety disorder. These are just kind of things to be kind of on the lookout for as parents. But I'd want to spend more time today talking about what we can do at home. These are some ideas. I'd love to hear from you guys. What are things that you do in your homes to try to keep the stress level a little bit down? And I'm always up for suggestions because I've got some things, but believe me, I don't have it perfect either. So I think it's good to be having this conversation. What works? What's been tried? Yeah. Not engaged, don't take it personally. That's good advice, absolutely. So when your kid is kind of like riling up and bringing the temperature of the house up, just like pull them back. I'm always a big fan of like the parent timeout, like because the best of us can't get frustrated, and it happens to no one's immune from this. Like there are ways that our kids press our buttons, and they know totally how to press our buttons in ways that kind of get us worked up. And when we're feeling emotional, when we're feeling frustrated, it's very hard to be our best parents, right? So, I'm all for saying like, I need 5 minutes, locking yourself in your bedroom, do whatever you need to do, play your favorite song, take some deep breaths, and then kind of coming back and managing a situation. If there's another parent there in the house, you can tag team or even just say like, I need 5 right now. Yeah.
I actually think that's a terrible strategy.
Okay.
I was an anxious teenager myself, and when my mother did that to me, that was like the worst. A parent just disengaging, I'm sorry, that does not help.
I really think, and I think it can. She was saying that it can be difficult if you're an anxious teenager for your parent to disengage and to step away for a little bit of time. And I do think like it really depends on who you are as a kid. I would say in general, I think it's better to give yourself a break or give yourself some time versus engaging with your kid in an angry way or in a overly emotional way. But certainly if you know your kid's going to get even more riled up with taking a break, then there are other alternatives. Either kind of say like, maybe let's press pause on this conversation, let's do something fun for 5 minutes and come back to it, or something along those lines. But just the main point is to not be kind of engaging when you're feeling really anxious or frustrated yourself. So I appreciate your thoughts there, and I think it helps us think through kind of in a more nuanced way how to manage that type of situation. Yeah. Mm-hmm. Yeah. Right. Right. Absolutely. Absolutely. And for me, it's also about modeling like how to manage, because if your kid is seeing that you're taking time and that you can get frustrated yourself, first of all, is showing your kid, we all get frustrated. We all feel strong emotions. And this is how this is how I'm choosing to manage it. I do think kind of having this conversation when kids are calmer, and just talking about, hey, listen, I know we've had a lot of like bang out fights recently. Moving forward, how about we have a plan where if either of us notice that we're getting worked up, we take a break and let's talk about how we can do that feels that feels supportive. We call it coping modeling a lot of times, like, showing our kids that, like, we also experience anxiety, we also experience strong emotions, and we don't always handle it right. And that can actually be comforting for kids because they're seeing it's not like everybody else has their stuff together and I'm the one who's kind of struggling with anxiety or strong emotions. Any other strategies that you guys use at home to manage stress or keep stress a bit down? Yeah.
We always encourage a lot of getting outside the house, like being outside,
Great.
and getting exercise.
Exercise, getting outside the house, like whether it's family walks. Our kids love those, right? Yeah, no, absolutely. And some do, but it's like, oh. But yes, absolutely. Kind of getting outside, getting some air, getting away from screens. Absolutely. Yeah.
Just these mini breaks, maybe. Just like, especially when you're trying to get the homework done and there's the procrastination because there's anxiety around writing, for example, for my son.
Yeah.
I have to just kind of break it down. Like, why don't we take a little break? And I think someone else at one of the talks, we have so many wonderful resources that we came in, but had mentioned that, and I thought that was really helpful to have. Like if they seem really worked up and anxious, I just try to kind of say, okay, let's take a break, let's do something else, and then kind of go back to it.
Absolutely. So to take, just kind of, it's another way of just kind of disengaging for a moment, letting us kind of reset a bit, or letting your child reset a bit, and guiding them through that process before kind of reapproaching a difficult situation. I think the one important thing, and I have the top here, and I've mentioned it a few times, is that stress is normal. Stress is okay to feel. It's a natural part of life. We don't want to feel it too much. We don't want to get overstressed. We don't want to burn out. But feeling stress in and of itself about school, about social pressures, about other things, it's normal, and it's actually important for kids to learn how to feel it and how to manage it. And it's often, like I've said, anxiety often worsens in kids when they do everything they can to not feel anxiety, to not feel stress, to escape those situations. So, I see our roles, certainly my role, and for parents and school as well, is to help kids feel and face those situations while minimizing all those like extra stressors. There's stressors that we can't just kids have to do school for the most part. That's a stressor that's there. And it's actually good practice because they're probably going to do work. So learning how to manage the stressors associated with that is a good thing. Managing stressors associated with socializing, they're probably going to have to be around people. Or that's our hope anyway, right? And so we want our kids to be learning how to manage those tough situations and putting themselves in situations that are a little difficult or a little tricky, supporting them with that and guiding them through that, but not letting them avoid those situations. And it could be really, really hard as parents because that means sitting with your kids' distress and oftentimes sitting with our own distress about, are we handling this right? Are we pushing our kids too hard? But I would maintain that more often than not, allowing your kid to face, a difficult school situation without escape or without rescuing or kind of pushing themselves in other ways, sticking with an activity, even if it's outside of their comfort zone, sticking with, allowing them to make mistakes is going to be much more helpful for kids than avoiding those situations. And it's a balance, right? So we want to be also, validating, or like being able to say to our kids, I know this class is making you really nervous, and I know you can handle it. Or I know this assignment is making you feel very nervous, and you can do it. Being able to empathize and understand, but also maintaining those expectations, but also maintaining realistic expectations. Our kids are going to make mistakes. They're going to fail certain things. This balloon is ominous. It's like, can we tolerate the uncertainty and the distress of, the saying that I include, I'll tell almost every family and kid is perfect is the enemy of good. And I think keeping that in mind as parents is important. to stress to our kids. You know, when we're striving to be perfect, when we're striving for a 4.0 or a 4.2 or like, you know, not, you know, making sure everybody likes me or making sure I get a certain number of likes on any Instagram post, striving for that perfection can get in the way of just functioning regularly and normally and doing well enough. And it can be hard, and it can be particularly hard for teenagers in high achieving schools and high achieving communities. And it's you know, there's baked in stressors, which is why it's so, you know, even more important for us as parents, school supports, you know, outside professionals to be preaching this idea of yes, push, and yes, try, but also know that, you know, it's okay to make mistakes. It's okay to be outside of your comfort zone. It's okay to feel that anxiety. And that feeling that anxiety and learning how to live with it is actually going to be a really, really great life skill that's much more important than getting an A on this upcoming test. It's very hard for kids to feel that in the moment. It's hard for us as parents sometimes to feel that and follow through with that in the moment. But, you know, in all my experience, that learning to kind of handle those mistakes and learning to push through them, you know, is the resilience that helps kids, you know, manage after high school, manage in college, succeed in life. You know, there's other kind of very specific things that can be done. I'm sure all your teenagers will get super psyched about a family game night. But it doesn't need to be like Scrabble. It can be, you know, it could be something a lot less formal. It could be kind of going out, you know, I don't know, to Dave and Buster's or something. It could be just like having some time. Again, you're not going to be like reading to your kid in bed, but, you know, having some downtime at the end of the day. You know, a lot of schools these days are really good about incorporating mindfulness into the school routine. And it doesn't need to be a formal mindfulness kind of time at home, but it can be, you know, what I'm actually a big fan of is, you know, having a Saturday where for 3 hours even, we're turning off the screens. Like it's Wi-Fi off, you know, from 12 to 3, and we're just gonna have some screen-free time. It's really hard, but it actually can be really, really helpful. And I know parents who have tried that, who have found, and even if it's an hour, even if you start with an hour, just to kind of like reconnect or even just read or just kind of do your outside walk, you know, helping kids just kind of disconnect from all of that, even if they don't feel good about that at first, can be really helpful. We talked about being a coping model, helping kids understand that, you know, you as a parent also feel anxiety. I will often try to tell my kids about anxiety-provoking situations that happened to me and how I handled them, and the ones I handled okay, and the ones I didn't handle okay. Like, hey, I had this thing happen at work where I kind of screwed up, and I had to talk to, you know, my supervisor. And at first, I didn't like talk to them right away because I was feeling really anxious about it. And then eventually I did, and it was all right, but I probably should have told them earlier. What that's doing is it's showing our kids that, you know, we struggle with this too. We all have anxiety, and it's okay to live with it, and we're not always perfect in handling it. It normalizes the whole process. And we've talked about it some, but tolerating our teens' distress, being willing to kind of sit with the fact that our kids are going to be uncomfortable. Our kids, you know, if our kids are feeling physically uncomfortable because of anxiety, it's still, you know, they can still be in school. You know, if a kid is feeling really, really kind of, you know, if a kid's feeling stressed out about doing an assignment, it's okay for them to keep working on that assignment. And it can be hard for us as parents to sit with that, but important. At school, you know, and a lot of these things I know, you know, I know the team at New Canaan has been terrific about, and so it's just kind of supporting a mistake-friendly environment, you know, and reinforcing that strong effort. Listen, there's a lot of pressure on our kids, and particularly, you know, particularly in Connecticut and Westchester and this whole area, you know, to get good grades, to be moving towards college. You know, certainly with recent news, it just kind of brings to light how much pressure there is about, you know, about kids getting into college. It doesn't help, but you know, balancing that pressure with, you know, what's more important than even those final grades is just like that effort and pushing yourself to try, and that it's okay to make mistakes. It's the kids who, you know, I had a kid recently, actually a young adult, who kind of came back and said, like, I wish I was allowed, you know, I wish my parents helped, like, helped me make mistakes in high school, because in high school I wasn't, that was terrifying to me to get anything less than an A. But I wish I had that experience earlier on, because it was so much harder as a college student and a young adult to learn how to do that. Allowing our teens to manage stressors independently at school, completing difficult assignments, allowing our kids to contact teachers on their own if they need to, doing their college applications, with support and with help, but doing those hard things. And then the piece that I think is really tricky now with the smartphones is when kids are feeling stressed, it's easy enough to shoot a text to you guys, right? Like, I'm really struggling with this, help, or I need to kind of, help me think through this, or how do I handle this? And it's hard not to answer, particularly if it's like help, exclamation point, scared emoji. And at the same time, helping, giving kids the message that, like, I know you can handle this. These are your supports at school, and then not engaging more in that texting or that calling is probably the best thing for kids in those moments, because they're learning how to handle a tough situation on their own. And this is something I've been talking about more, because I know it's been, unfortunately, I see more and more of these kids who are kind of going in the bathroom and texting parents a lot, or texting other people a lot. It's tricky, it's hard, and it's a really hard spot for parents to be in, because your kid's not there. All you're seeing is that they're in a whole lot of distress. I feel confident saying this here, just kind of know the team in New Canaan. You guys have a really good support staff in the school, and it's important to kind of trust that and to help our kids know to trust that. And then the flip side is encouraging our teens to seek support, to seek support from teachers, from guidance counselors, from other supports at school. And then obviously when they're home and when they're with you, seeking support at home. Any questions so far about what we've been touching on? Yeah.
All the physical symptoms that you're talking about, do you recommend, because I've seen cases where they really have a physical problem.
Sure.
And then people will continue to say, oh, well, this is anxiety, but it's really not, because there's, a lot of very difficult physical things to diagnose.
Yes.
And so if you jump right to anxiety, the physical symptoms do cause anxiety because they don't feel well.
Absolutely.
So which came first, the chicken or the egg?
What I will do whenever I'm working with a family and there's physical symptoms of anxiety, I get them cleared first. If there are headaches, I'll say there's a good chance this is anxiety driven, but let's just be sure. Let's meet with a neurologist. Let's just cross off those other possibilities, just to make sure, because I don't want to push a kid if there is a physical problem. Similar with stomach aches. If let's make sure there's not something that's, bless you, that's really that's really of medical concern that we're not addressing in the right way. But more often than not, what happens is there is a genuine physical problem, and then also those kids have anxiety on top of that. So if there are headaches to begin with, anxiety can make those headaches worse. If there are GI problems to begin with, anxiety can make those GI problems worse. And so the question for me is this a problem that is the physical problem in and of itself getting in the way of this child not being able to function in school? And then we need to work with medical professionals to think through what are the proper accommodations and supports, and how much of this is anxiety. And even if it is genuine physical, can this child kind of function at some level in the school setting, because there's costs to not. What we've had, I'm thinking of a poor girl we had who actually had a lot of kidney problems and had a colostomy bag that she wore kind of pretty permanently. And it was terribly embarrassing for her. And she had a lot of physical problems and a lot of GI concerns and would need to go and empty her bag during the school day. Now that's a real big, severe physical problem. And we also decided it was very, very important for her to learn how to function in the school setting, because this was going to be her reality. And there was a lot of anxiety around that. And we worked with her and, on how to manage the anxiety about that, how to kind of work through, discrete ways to kind of use the bathroom and do all of that. but she'd missed a good year of school just because of all of her concerns about managing that piece. And there was a real physical piece. But, by addressing the anxiety and by helping her parents set the expectation that, we get this as a problem, going to school is not not going to school is not an option. That's not negotiable. How do we put a plan in place at school that helps you? And that, that helped this kid. But, we'll see many, many kids with legitimate physical concerns, either concussions or, other physical concerns. We always want to get it medically cleared, but we also want to send the message that, you can, there are supports and ways to kind of help yourself at school, but we also want to see you doing your day, because that's going to be important for them in the long run. In terms of when to seek help at school, or when to kind of touch base with a teacher, an assistant principal, a school psychologist, if you see your kid frequently worrying or getting anxious about either schoolwork, school pressures, or attending school, if it seems like more than just that normal academic stress, I always encourage, reach out, have a conversation with school, partner with school. If you see your kid avoiding schoolwork or putting too much time into schoolwork, reach out. Or if your kid, begins to resist school or tries to avoid certain parts of school, a lot of times what we'll see, particularly with our kids who are having trouble even getting to school, is sometimes there's already like a baked in tension between kids and school. And what I love here is I see school folks, I see parents, they're, even just in this room, there's a partnership. But it could be hard to kind of seek that help. And a lot of times there can be a tension between parents and school, just around getting to school and managing anxiety and what accommodations are needed or supports are needed. In my experience, being able to kind of all sit around a table and say, what are our problems? What are our expectations? And how do we solve this together? Can be really, really helpful and important. And I know I'm preaching to the choir here, but I just wanted to, underline that point, because, particularly here in New Canaan, there are really, really good supports and a team that, I know is sensitive to these concerns. When to seek help outside of school? I would say, this is a lot of the work that we do, and I would say if anxiety is certainly generalizing outside of the school setting, or certainly if the school setting saying, recommending, hey, it might be helpful to find, a resource outside of school. Addressing anxiety in our kids, like I said, the treatments are effective, and anxiety does linger. So if a kid's anxiety or worry is chronic or causing significant impairment or distress, as we talked about before, or if school's saying maybe this could be helpful, it could be helpful. Treatments are typically time limited. I'll talk about in specific what they are and what they look like. I'm a psychologist, so I provide what's called cognitive behavioral therapy. It's our frontline evidence-based treatment for anxiety. Essentially what it looks like is giving kids and families skills. It's a treatment focused on modifying behaviors and thoughts to reduce anxiety. So what do? We give a lot of psychoeducation about anxiety. I'm telling kids a lot of the things I'm telling all of you, learning about those physical symptoms, learning that they are genuine and that anxiety can cause them. It's our fight or flight system kind of going haywire. We're also talking about when we're anxious, our thoughts kind of get a little negativistic. Think about it when you're anxious, how, which thoughts stick. It's all of the what ifs, right? All of the, this may happen and that may happen. And what if this happens? And what if that happens? So just learning to think more flexibly, learning to be able to kind of ask ourselves in the moment, well, really, what's the worst that can happen? Or what are the chances that'll happen? Or can I sit with this worry and still do the things I need to do? Just to kind of give an alternative to, to all that automatic worry thoughts. And then the central component is really what we call exposure. It's gradual exposure to those feared situations. So what I'm doing the majority of time is helping kids face their fears. I will have kids come in and we're doing test answers quickly, or we're making mistakes, or I'll guide kids in texting a friend or a kid who they've never texted before and is really scary because, oh my goodness, what if he doesn't text me back? Or what if he says I'm busy this weekend? Or what if, all of those what ifs. For the kids who are nervous about having certain physical symptoms, we'll actually bring on certain physical symptoms in a gradual way. But I know it's kind of bizarre. Because a lot of times what happens it's not like the stomach ache that's distressing. It is, but it's the fear of what if that happens? What if I get to school and I feel these horrible feelings? What if I feel dizzy or lightheaded at school? So no joke, like I have a wiffle ball bat in my office, and we'll practice kind of spinning around it 10 times. It feels gross. It feels dizzy and lightheaded, and you feel almost like you do when you're really anxious. And I tell kids we're doing this so that we can tolerate this feeling, and we can learn that if I can have this feeling and still, go to school or still do this or that, I'm all right. That frees me. And the more the kids learn to tolerate those physical feelings of anxiety, it frees them to show up to those situations. The more kids learn to tolerate uncertainty, the more situations they can face. The more they learn that they can kind of make mistakes and be okay, again, it frees them. And so the treatment is really about helping kids face those fears, helping kids tolerate those situations, and guiding parents in the very difficult job of, setting expectations and holding kids to their expectations as a teenager, while also providing empathy and support and understanding, like, we get it. Like, we understand this is hard for you. Anxiety is no one's fault. It's not kids' fault for feeling anxious. It's not parents' fault that your kid is anxious. We all have, a certain genetic temperament and vulnerability to anxiety. Some of us is higher than others. And, for kids, it's a matter of saying, all right, like, this is what I got. I have a vulnerability to anxiety, and this is what I need to do about it. Almost like if that kid had asthma. Like, all right, I've got asthma. I know I've got to carry this inhaler around. All right, I've got a tree nut allergy. I know I got to take this EpiPen wherever I go and ask, like, is there nuts in this? All right, I've got anxiety. I know I've got to push myself a little bit each day. I know I'm going to have that inclination to avoid, and I've got to push myself through it. I think about it in very much the same way. And, as a parent, I think about how do you support your kid with anxiety, just as you support your kid if they had a physical problem, kind of guiding them through the facing their fears in a supportive way and not in a blaming way. And what I'm doing as a therapist is really just acting as a coach, and kind of teaching these skills, but then practicing these skills. And my hope is always that, at some point I become unnecessary, because a kid and a family system is learning how to face fears more and more independently, handle anxiety more and more independently. I love it when a family comes in and they're like, hey, we don't think we need to see you next week, or we're kind of good on you. Like, I'm like, good. It hurts a little, but awesome. That's always my favorite. There's another frontline treatment for anxiety. A lot of times, families don't like to think about medication. And what I always say is, for mild to moderate anxiety, let's try therapy first. That's actually like the American Academy of Pediatric Psychiatry. That's the recommendation. Is we've got 2 treatments that work: cognitive behavioral therapy and SSRI medications. For our mild to moderate anxiety kids, let's try the cognitive behavioral therapy first. If that doesn't work, we've got medication as a second option. We'll try the 2 together if a kid is very, very severely impaired by anxiety. And when I say severely impaired, I'm talking about like not getting to school, not leaving the house, which unfortunately happens sometimes, just not really functioning at all. So, those are those situations where we'll think about both. But, a lot of times kids get some better on therapy, get more better with that combination. These medicines are safe. They've been around for quite a while. Right now, the very common ones are Zoloft, Prozac, Lexapro, Luvox. What you'll probably find if you do research on this is none of these are FDA approved for child anxiety. And it's not because they don't work, and it's not because they're not safe. It has very much to do with there's no reason the drug companies right now these drugs have been around for so long, these medications have been around for so long, there's no incentive for them to do the trials to get FDA approval, and there's not funding for it. So it's unfortunate, and it sends a lot of kind of mixed messages to parents. And that's why I always kind of, even though I don't prescribe medicine and I always want to try to do what I can with therapy first, I'd much rather have a kid take a medication for a period of time if it will help them function and move forward and learn how to manage anxiety versus not having that experience and really, really struggling for a period of time. kids typically take these medications, teenagers, a minimum of 6 months. Some kids after 6 months or a year, have learned skills they don't necessarily need it anymore. Some individuals do take medication for a longer period of time. But if a kid is taking medication, I would always want it to be paired with that cognitive behavioral therapy, or for them to at least have a course of cognitive behavioral therapy, in their history. And if you're out like in the marketplace seeking therapy, always ask if, particularly for exposures or particularly for anxiety, if they do exposure therapy. A lot of folks say they do cognitive behavioral therapy. Many do the full shebang. For some people, that's just like relaxation and, some other skills. But the core component for cognitive behavioral therapy is that exposure piece, is that helping kids face their fears. Are there particular questions on treatment? Good. All right. Well, I certainly did want to leave, at least 20 minutes. It seems like we have a little bit more of that. So I'm just going to go through a couple more slides and then open up for more general Q&A, because I feel like that is often helpful. I keep this in mind a lot, particularly with all kids and all of us really, but particularly when managing anxiety, it's not linear. Like progress is not linear. It's almost always like 1 step forward, 2 steps back, then 2 steps forward, 1 step back. And so a lot of times when we're managing our kids through stressful situations, there are going to be times that don't go so well. There are going to be assignments that don't get done. There are going to be days that feel like, that look on paper like a failure. But if you're kind of staying consistent and sending the same messages, that's what's going to help our kids in the long run. So if we're sending that consistent message of, minimizing stressors where we can, facing our fears, trying to think more flexibly, and seeking supports to manage anxiety, there are going to be days that are hard, but there are going to eventually be more easier days than hard days. And I stress that we'll do phone coaching for our kids who are really having trouble getting to school. We'll make ourselves available early morning. And a lot of times it's the parents who will call to say, like, I can't get my kid out of bed. Like and there's nothing I could do. They're 16, they're bigger than I am. Like, I've got to go to work in 10 minutes. And what my message is essentially like, you're doing the plan. Like, trust the process. A lot of times it's just making sure that home is not so reinforcing. So we'll say like, did you do everything you're supposed to do? Like, they don't have access to Wi-Fi or this or that. So even if your kid's not getting to school that particular day, you're doing your job. Hold steady to that. And then let's talk about it the next time we have a meeting, and let's figure that out. There's not every instance will be a success, but holding firm to these principles is what's most helpful. These are some resources that I find particularly helpful. What's frustrating for me, someone's got to get on this, there's not like a great parenting book for teenagers with anxiety. Typically they're more general, but these two both do address adolescence, and these two psychologists are terrific. Anne-Marie Albano is actually a colleague of mine at Columbia. She's kind of been at the forefront of assessing and treating anxiety disorders in kids and teens. So her book is terrific. Freeing Your Child from Anxiety is a favorite of mine as well. It incorporates a lot of these ideas and principles that we're talking about, and just is like it's almost like the baby book you carry around that first year, just as like a reference. It's just like a reference, like kids not doing homework. Let me check the anxiety book and see what do they say about doing here. And then I love this Mindshift app. I'm always hesitant to kind of recommend apps and more smartphone stuff, but this one's really good. It's it's geared towards teenagers. It has a lot of psychoeducation about anxiety. It also builds in flexible thinking for the range of worry topics and anxiety. It has built in mindfulness apps and relaxation apps and all different things. So, if there is an app to put on your kid's smartphone or to encourage them to add, this could be a good one, even just as a stress management strategy. And certainly, we're always a resource as well. So, my hope is that, even just in terms of consultation, I'm always willing and happy to talk with parents who just, want to have a sense of, hey, this is what we're seeing. Is this something that, we should seek out treatment for? Is this something that, we could take a wait and see approach for? Are there folks in the school setting we could talk to? And just to have that conversation. And if treatment feels like appropriate, then we could talk about options there. There are certainly good folks in Connecticut. I was having the conversation before that unfortunately what's happened now is there is a shortage. It seems like, it's maddening to kind of manage the mental health landscape and the treatment landscape. Everyone's full. Everyone has a wait list, us included. It's frustrating. I hate to say it. But I say this because I'm really sensitive to how hard it is for parents to kind of get to know what's the right help to get and then to find it. And so I'm always happy to kind of put time aside just to have a conversation and help guide folks in the right directions. And then if those are dead ends, give some additional names and resources. And also why I think having meetings like this and conversations like this to partner with schools to identify kids even earlier and help kids before their anxieties at a level that treatment would be indicated. So, I always, I love these opportunities, and it's an honor to kind of be here and talking with you guys and partnering with the staff at New Canaan just to support our kids, because listen, it's stressful. Like more now, we were talking before this meeting about, is anxiety worse now? And believe me, that's asked to me all the time. Like, are we just like, what's with this explosion of anxiety, right? Like, we feel it. And I hear from a lot of districts that like more and more kids are anxious, more and more kids are not getting to school. What's going on? I don't think our genetic vulnerability to anxiety has changed. I don't think that there's anything like internally that's changed. I think that, like we were talking about before, we're exposed to so many things nonstop, like it's hard to turn it off. As adults too, right? Like the news is constantly going. Like we're getting alerts like this bad thing happened. Now this bad thing happened. Now that bad thing happened. And oh my goodness, Odell Beckham got traded. Like there's like so many things happening, but also, it's the little things too. It's we know exactly where like every single person we know is and every single time. And, we're seeing these procured lives of like everyone around us. And we compare that to our imperfect lives, and for teenagers who don't necessarily have that perspective to kind of get it, it could be very, very stressful and anxiety provoking. So the more that, professionals and school staff and parents can partner to model stress management, but also to model kind of facing anxiety and learning to live with anxiety. Because the truth is, I don't think the smartphones are going away. I don't think like the constant news cycle is going away. So it's our job to figure out how do we manage it ourselves, and how do we help our kids learn to manage it without becoming overly stressed or anxious. So I'm going to stop there because I do want to leave time for Q&A. And always happy to kind of follow up afterwards as well. Yeah.
Are there any initiatives, you've helped us as parents, but as a school district, are there any initiatives that are successful out there? I know in California they're trying to leave their phones out of the school. In Asia they meditate before they go to school. In England they're doing a lot of things in the school to kind of like give them an area where they can just, if something's too much. But it's more about also, I know, because my sister-in-law in England is very involved with kids with anxiety. And it's more about they're embarrassed to go, they're more embarrassed, they'll go for help outside of school so nobody sees them go. Yeah. Is there anything that we can do in New Canaan, that it's okay to go and see the counselor? It's not a bad thing. Is there anything that we can learn?
Yeah, no, absolutely.
Do you want, Tony, just to tell you, Dr. Susan Bliss, who was right in the back, who is our district-wide social and psychological coordinator. Susan, do you want to stand up and speak a little bit about the initiative that we're doing?
Here you go.
With Mark Brackett and how it's going to filter into the high school
I'll just take
next
a
year.
second to say. It's a great question, and we have been very concerned. We know the national trends about anxiety and stress, and as Anthony's been saying, it's just something we want to make sure that we're preventing, not just trying to solve, but preventing and helping kids really learn. So we've been starting an initiative throughout the district on emotional intelligence. We're working with Yale. We've sent many of our faculty there to learn the skills, and the skills are about recognizing, understanding, labeling, expressing, and regulating emotion, right? Really helping kids to regulate, because we know that's a part of preparing them for college and life, is the ability to manage these emotions. So that has been in the works K through 8. This entire year we've been rolling it out to our kids. This year we've been focusing on the faculty first, so the faculty learn all the skills so that they have them and they can work with the kids and integrate it into everything that we do. Kids will be learning the skills in our connections class, which is it's a class that meets for 20 minutes every other cycle, and kids are really focused on the social emotional in those classes. So we'll be doing more of this, and we certainly are always open to your feedback. We've had a connections class, we've been doing it. This is just another addition. In fact, this whole year, our connections class also focused on helping kids with breathing and different ways to manage stress throughout the year. So I think there's a lot of exciting things going on, and we just look forward to partnering with you and enjoy the feedback, whatever it is. So thanks.
I think that's terrific, and I think, I know a lot of districts have been incorporating mindfulness and wellness into their curriculum. I think those are all terrific. I love the idea of leaving phones at home. I know that's such a thorny piece. I have a 5th grader, and we just went through the whole battle of, I need a phone because it's middle school, and everything, I get it. But I do think that, at least minimizing, availability with smartphones during the school day, or at least as a parent saying, let's, not engaging in a lot of that conversation during the day. The school psychologist, having a school psychologist or contacting the school, I think is always terrific. I also know there's limitations. So, I know that, in a lot of districts, the school psychologists and other staff are do as much as they can to kind of meet with every student, but also don't necessarily have the ability to kind of do weekly therapy sessions with a number of kids. So it's always a balance in the district. But I do think even just having a conversation, even just like building into curriculum early on, what is anxiety? How do we do this? Well, we've started working on this year with like a brief curriculum for kindergartners and 1st graders. I know it's a little late for our high school groups, but like just talking about what is anxiety, like what is being brave, and teaching kids to kind of like label their feelings and to approach anxiety with facing their fears versus avoiding them, and like setting up like brave boards in the kindergarten classrooms and things along those lines, just to kind of get that message out early that anxiety is a thing, we've all got it, it's nothing to be ashamed of, and we can approach it by, talking about it, seeking help, but also facing our fears. So I think it's moving, and I think it needs to move a lot more, particularly in our current climate, to kind of more systematically talk about anxiety. I will say, I think part of the reason we're hearing so much about anxiety is because people are talking much more about anxiety, which is a good thing. There are NBA stars who are talking about their own panic and anxiety, which is great. There's pop stars who are kind of being open about their struggles with anxiety, and I think it's all in the vein of that coping modeling, which is actually a good thing, as long as it's kind of discussed then in the context of family and all of that. Other questions?
Can I just add to that too?
Mm-hmm.
So for parents, I'm one of the school social workers, and for parents that don't know what Connections is, every 2 weeks, a group of students are connected, about 10 or 12 students are connected with an adult in this building, and they meet. And there was a committee that has been putting together lessons for several years, and this year's lessons were all around dealing with stress, coping activities, mindfulness activities. And actually one of the neat things that it was kind of for a dual purpose. One is to give every student in the building a connection with an adult, other than their guidance counselor, the school social workers, the school psychologists, the teachers, that if they need to, that they could get to know a little bit more through that bi-weekly communication and interaction. But also to learn some of these skills. And one of the things that the students did was they put together their own mindfulness activities. So they took what they've learned in the lessons that they did throughout the year, and they created their own lessons, and it was put into a book, which was shared with every faculty member in the school. So teachers can incorporate some of that in the classroom. And for example, like in English class, if they're talking about character development, they can use the feelings of the character and normalize the stress that they felt, what they did to cope with it, and so really kind of infuse that learning into the educational environment. I also just wanted to say in terms of counseling services in school, it's really for the purpose of helping kids access their education, making progress, engaging in the learning environment, and helping them cope with any social emotional difficulties. Whereas outside counseling is more of what you're talking about, is the cognitive behavioral approaches, the skill set, which is a more lengthy and includes the family more, I think, in terms of treatment options.
They also would want to say to parents, your child has the same connections person
Yes.
all 4 years, which is really important.
Yep.
I have a senior right now, and I happen to know his connections teacher, and the growth that he's seen from freshman year to senior year is really helpful. And of course, there are significantly different stressors freshman year to senior year, but that person is a constant, and in the 8-day rotation, it's actually very nice. And with the new program next year, I think it will be exciting for the students.
Yeah, and it's nice that they not only have that connection with the faculty member, but also between kids that sometimes they wouldn't have classes with, or they wouldn't really get to know. It becomes almost like a small group, setting where they can get to know and experience different things in a smaller setting than a classroom.
But do all teachers get exposure to like talks like this?
Well, that's what the rollout of the social emotional learning that Dr. Bliss was just talking about.
So the teachers in the high school have started, the faculty has already started this rollout. They started with the teachers, and then the students will have it next year, and the K through 8 component also started this year. But they were tackling the faculty first at the high school, and then the students.
To educate them and recognize them.
Yeah, exactly, because one of the things that Dr. Bliss had found is that the faculty will have their own needs and social and emotional intelligence and support, and because our students are interacting with them, if we bring them on board first and help them, then they can help our students. So it's the way of doing it that way.
I would just add that the mental health team has put together small presentations on some of the more common mental health issues that we're seeing in school. And we've been going to department meetings to share that information with the smaller departments. So teachers are being exposed to information about the various mental illnesses that we're seeing more in the school setting.
So what it would look like, how it may manifest itself in the school environment, and also some strategies to use. But also, we're all constantly in communication with teachers. So if teachers have, and they're really, really good here with, if they have any concerns or questions, or just have, not sure how to address a certain student, they have access to us for consultation.
But like you were saying, how the students need to know what these disorders are and just follow it up. Are you teaching the students that, or are you just teaching them how to manage it? Because I've actually spoken to people in the past about just giving the kids a board without anxiety or depression or this or that, and these are your resources, and I haven't heard any of you say that that's happening. So
Yes, actually that was part of a connections lesson, is they got a full sheet, and it's also on our school website, of all the school resources, including the school
But
nurses.
are you telling them this is anxiety, this is depression, this is what, and this is, because I think that's what you're saying, is you're telling them this is what anxiety is. And I think that everyone's sort of tiptoeing around that, we're afraid to talk about that, but you're teaching them strategies to deal with that without saying that this is anxiety, this is how you deal with it. Right, you're not labeling
We need to
it.
have all this on the mic, none of this is going to be on the video. All of this needs to be on the mic.
So are you saying they need to be able to label what the feelings are, like the anxiety or this, and then teach the strategies, or you say, because they're working on the mindfulness component without saying, this is anxiety, this is common, this is what people feel.
Yeah, so the question is more about what, exactly how much information is getting to students. I'm going to give it to Dr. Bliss, and then I can certainly follow up there, just because you're more in school.
That's in our health right now curriculum, and we're actually working on revising that curriculum and making it be something even more meaty for
I talked to someone
kids.
about that a couple of years ago, and they were reluctant to put that in the health curriculum, because that's exactly where I said it should go.
Right.
Because they said the parents would get upset and this and that, and they were afraid of saying the parents. They were, a few years ago, resistant to putting it in the curriculum. Now, I'm not saying you go into terrible detail, but just that people are aware of
But mental health and physical health is all part of our health curriculum, even for kindergarten. We are doing some things very early on in terms of health, and we want for kids to think about it that way. It is that. It's both mental and physical, and it's about having the skills to do that. So we are shifting, yeah, there are some shifts.
Liza, we had another question.
I wonder if it would be helpful for the pros and cons of sharing that with parents, what kids are hearing and talking about in connections, because some teenagers don't come home and talk to their parents about that out there. And to continue that discussion beyond just how was your day or how was lunch or whatever, to just be able to start that conversation with your child, teenager at home.
Yeah, I think it's, so the question is essentially saying, kind of giving information to parents as well, particularly about what information is being provided to students. And I know that, it's a balance, because not all the information that kids are getting can be always sent in very detailed ways back to parents. But I do think, regarding this, it was actually New Canaan that, and Dr. Bliss that asked me a while back, hey, can we have some facts about school refusal just to kind of help communicate with parents? And it actually encouraged me to think that's a great idea. And it's something that now, we've been able to do. And, I think having a, info sheet or something along those lines about anxiety for parents and for kids is a really great idea. I think that even it's helpful for kids to know, just like they learn about physical problems, to learn about mental health problems and what they are. I think that just as important, if not more so, is learning also about normal anxiety and stress, and that we all feel it, and normalizing that, and then distinguishing that from anxiety disorders. And it doesn't need to be super detailed, but just to give that information and to give resources like these, or folks at school you can talk to, or this information has been given to your parents. So what are ways that you feel most comfortable seeking help for this? What I always want to avoid is kids just WebMDing or what is anxiety, because there's some good stuff, but you'll also kind of go down a rabbit hole. So I think all of it's great, and I love just the conversation about how do we help kind of get this information to our kids in healthy ways, and how do we have healthy conversations with our teens. If they're not going to have it with us as parents, then with someone at school or someone else. So I think I think everyone's aligned here, and it's just a matter of how do we do it in the most effective way. Other questions? Yeah.
Would this be a silly idea, but we give so many apps to the kids, if you need help with math, then you can do this, and there's Khan Academy. Could we have a space on the website that says, hey kids, so they don't have to feel they can come to us, or if they're too embarrassed to go to somebody at school, can they just say, if through connections, can we say, look, there's a place on the website, if you're feeling stressed, nobody has to know, but you can go here, and you can do this, this, and this, and then sometimes these kids are so proud that they feel that they can do it themselves, but maybe would that help? By giving them, so they're feeling they're doing it themselves.
Yeah.
And we're empowering them to take charge, like you said, to just kind of care it.
That's why I love that app, that Mindshift app, because it has a lot of just information, almost self-help information for those kids who aren't necessarily going to seek out help. Whether there are options even just to kind of guide kids to certain resources through, the Google Classroom or through the website, that's certainly something for the district to figure out and decide what's feasible. But I would say even beyond that, having that type of app on your phone and just saying, hey, listen, those times you don't feel like finding me, finding dad, finding whoever to kind of talk about this, this is something that can help you. And some kids don't necessarily need the full out treatment, but having that just anchor and just a refresh can help. Other questions?
Well, actually, I have a question about depression. I know it might take you to come back for another meeting to talk about it. But my question, maybe this is a consideration. Does anxiety or pressure or fear cause depression? Are these two related?
Yeah, so the question is about depression, and can anxiety lead to depression? Can pressure lead to depression? The short answer is yes. One of the reasons we like to address and treat, anxiety disorders early on is because if left untreated, anxiety disorders can lead to depression. Not always, but they can. It can lead to substance abuse. It can lead to trouble in college. So we don't, yeah, so, and, sometimes depression will kind of come, develop independently of anxiety. They can coexist, and if a kid or a teenager is feeling depressed, it can make it that much harder to work on their anxiety. I would say if you're concerned that, your child is depressed or depressed and anxious, certainly with depression, I always recommend seeking professional help. There are therapies that can help. There's medication, even more so than anxiety, can help with depression in a short-term way. And my approach, if I'm seeing a kid who has kind of both anxiety and depression, that they're struggling with, if it seems like their anxiety is really leading to their depression. Like if I have a kid who's so socially anxious that they're isolated, and because they're not seeing friends and doing nothing on the weekends and sitting by themselves in school, they're getting depressed. If that's the case, I'm going to treat the anxiety with the idea that if this kid's kind of out and about more, their depression will lift. But sometimes there are kids and teenagers whose depression is just kind of sitting on them so heavily that it's hard to do much of anything. And there, we're really going to focus on how do we manage those depressive symptoms, both with therapy and with medication.
And sometimes from outside, the kid look perfect.
Mm-hmm.
Academically and socially,
Yeah.
but inside you can feel sometimes, they feel just bad.
Absolutely.
It's hard to detect, but, how do we deal with it?
Well, I would say, all these ideas we're talking about, also apply to depression. Because you might see your teenager, and they're not coming saying, I'm feeling depressed, or I'm feeling really worried, or I'm stressed out, but you see the irritability, or you see the difficulty sleeping, or you see just like they're not themselves. I would certainly kind of make yourselves available, check in with them. They may not say anything, but at least they know you're available. I would also I recommend they speak to someone at school, or recommend that, give them these resources we're talking about. But if they're not, if you're not seeing improvement, that's when I would, meet with a professional. And believe me, I've seen many teenagers who are kind of dragged to my office. I get it, they don't want to be there, but often they'll end up talking some, and even if it takes a little while, someone like myself or a psychiatrist can at least kind of give some recommendations and support a family system in managing that, because it can be scary. It can be really scary. I know we're right at 11, but any last questions or thoughts?
Do you have an opinion on school start times and anxiety?
Oh my goodness, you hit my favorite topic. I would love school to start later.
I feel that my anxiety because of school start times and not being able to get my kids out the door is through the roof. So my own anxiety is high. Never mind theirs.
Yeah. Adolescent circadian rhythms are such that they start later and they go to sleep later. So.
And that saying that you had about don't let the perfect be the enemy of the good.
Mm-hmm.
I think my husband says that once a day to a child who will not go to bed because they're just doing their homework till the wee hours of the morning, and then they can't get up to go to school.
Right. So that's a bigger issue, and sort of I don't think we're going to kind of get things moved to where the buses come later and everything else. But I do agree. I think it's just another stressor that's kind of baked in. Guys, it's been a real honor. I really appreciate all of you kind of participating and giving your thoughts. As you can tell, I'm not perfect with this stuff. Perfect, you're good. But it's always helpful to kind of hear feedback and to be working together to be supporting and helping our kids. So thank you, and don't hesitate to reach out if you have any questions. Thank you, Renee.
Thank you, Tony. It's an awesome talk. I want to thank everyone for coming, and we're very excited also to remind you guys that next week we have our fabulous revamped career night. I hope all of you and your students can attend. It's going to be really exciting. Thank you so much.
Oh, you're welcome. Thank you.